Right now, somewhere in a hospital, a surgeon is preparing to open someone's skull. Machines hum, monitors blink. A team of specialists stands ready with tools precise enough to work in millimeters. It feels like the pinnacle of modern science. But 7,000 years ago, someone did the same thing. No machines, no anesthesia, no germ theory. Just a sharpened piece of stone, a steady hand, and a person willing to trust it. And the strangest part isn't that they tried, it's that many of them lived. This is the story of trepanation, the oldest known surgical procedure on Earth. Your ancestors were cutting into skulls before they had written language, before they had the wheel, before they understood what a brain even did. And yet the bone tells a different story than you'd expect. It tells a story of survival. Here's what trepanation actually is. It's the deliberate removal of a piece of the skull while the patient is still alive. Not after death, not for ritual disposal, while the heart was still beating. Archaeologists have found trepanned skulls on every inhabited continent except Antarctica. Some are 10,000 years old. Some are from cultures separated by oceans, with no contact, no shared language, no way to have copied each other's methods. Which raises a question that still unsettles researchers today. How did so many unrelated groups of humans independently arrive at the same radical idea? Cut open the head to fix something inside it? The first person to take this seriously as science rather than superstition was a French physician named Paul Broca. In the 1860s, Broca examined skulls from Neolithic France and noticed something that shouldn't have been possible if these were just ritual killings or post-mortem rites. The bone around the holes wasn't jagged or fresh, it was smooth, rounded, healed. That meant the person had survived the surgery, sometimes for years afterward. Broca had stumbled onto proof that Stone Age humans understood something about the body that modern medicine wouldn't formally chart for centuries. Bone remodels itself after trauma, and remodeling takes time you only get if you're alive. Think about what that healing actually required. For new bone to form around a wound like that, the immune system has to fight off infection. Blood has to clot correctly. The brain's protective membranes have to survive direct exposure to open air without swelling fatally. Your body is doing dozens of things right now to protect the 2.5 pounds of tissue inside your skull. Ancient surgeons were removing that protection on purpose, and somehow a large number of their patients kept living. How large a number? This is where the research gets genuinely surprising. In Peru, archaeologist John Verano at Tulane University has spent decades studying trepanned skulls from pre-Incan and Incan sites. He's examined over 800 skulls with trepanation evidence, and his findings show something remarkable. Survival rates improve dramatically over time, from around 40% in early periods to as high as 80 or 90% by the time of the Inca Empire. For comparison, survival rates for skull surgery during the American Civil War, thousands of years later, and with metal instruments hovered around 50%. Somehow, ancient Peruvian healers were outperforming 19th century battlefield surgeons. So why were they doing this at all? The honest answer is that researchers don't fully agree. But the evidence points to a mix of very practical reasons. Head trauma was common. Warfare, falls, blunt weapons, accidents. Skulls found with trepanation holes often show a fracture or wound directly beneath the surgical site. That suggests the procedure wasn't random or purely spiritual. It was often a response to visible injury, possibly to relieve pressure from swelling or bleeding beneath the bone. In modern medicine, this exact concept still exists. It's called a craniotomy, performed today to relieve dangerous pressure on the brain after trauma or stroke. Your ancestors may have been treating the same emergency you'd be rushed into surgery for today. They just didn't have a name for intracranial pressure. They just knew that opening the skull sometimes helped. That doesn't mean every case was purely medical. Some trepanned skulls show no sign of prior injury at all, which has led some researchers to propose spiritual or ritual explanations. The idea of releasing evil spirits, treating epilepsy, or addressing what we would now call severe headaches or mental illness. And this is where the history stops being simple. It's likely both explanations are true depending on the culture and the century. Medicine and belief weren't separate categories to ancient people the way they often are to you. A person suffering from seizures might have been understood in a given culture as being possessed. The treatment for possession and the treatment for a brain abscess might have looked identical from the outside. Different explanation, same blade, same skull. What's even more striking is the evidence of specialization. Some skulls show multiple trepanation sites, meaning the same person survived the surgery more than once. One skull from Peru shows evidence of 5 separate procedures with clear healing after each one. That's not luck. That's not a single desperate attempt. That's a patient who trusted the same method enough to undergo it repeatedly and a healer skilled enough to keep them alive each time. Historian and neuroscientist Charles Gross, who wrote extensively on the history of trepanation, noted that the consistency of technique across many skulls from the same region suggests these procedures were performed by specialists, not random members of the tribe experimenting. People who had done this before. People who had, in effect, trained. Consider what that training must have looked like without written instruction. No textbooks, no diagrams, just observation, oral tradition, and the terrifying trial and error of learning on real human beings. They would have learned which tools caused the least damage. Sharpened obsidian, flint, and shell were common instruments, chosen because their edges could be made thinner and sharper than most metals available at the time. They would have learned how much pressure not to apply, since pressing too hard risked puncturing the membrane protecting the brain itself. They would have learned, probably through failure long before success, roughly how large a hole a person could survive. And that's the detail that should stop you. Roughly how large a hole a person could survive. Someone had to find that boundary. Someone had to lose patience to learn where the line was between a procedure that healed and one that didn't. Every successful trepanation you're reading about right now was built on the data of people who did not survive. That's not a comfortable thought, but it's how essentially all of early medicine advanced, including the medicine practiced in the hospital near you today. There's also something quietly moving in what the aftercare tells you. Several trepanned skulls have been found alongside evidence of long-term community care. In some burial sites, individuals with healed trepanation wounds show signs of having lived for years afterward, well cared for, well fed, integrated back into daily life rather than isolated. That tells you something about the society around the surgery, not just the surgery itself. Someone had to protect that wound from infection during recovery. Someone had to feed a person too weak to hunt or farm. Hey, someone had to believe this person was worth keeping alive through a vulnerable, dangerous recovery period, long before anyone understood what bacteria were or why cleanliness mattered. You probably think of ancient humans as struggling just to survive the next season, focused entirely on food and shelter and threat. And in many ways they were. But somewhere in the middle of that struggle, groups of people, independently, on different continents, thousands of years apart, arrived at the same conclusion: that the skull could be opened, that the person inside could be saved, and that the attempt was worth the risk. That's not primitive thinking. That's the same impulse driving a modern neurosurgeon tonight, standing over a patient with a fractured skull, deciding that intervention gives a better chance than doing nothing at all. The tools have changed almost beyond recognition. Obsidian became steel. Steel became lasers and imaging and monitors that track a heartbeat down to the millisecond. But the core decision hasn't changed at all. Someone is hurt. The skull is the barrier. And a person willing to cross that barrier might be the only thing standing between survival and loss. So the next time you picture a hospital sterile and humming with machines, remember that its oldest ancestor wasn't a building. It was a person kneeling beside someone in pain, holding a sharpened stone, and deciding to try anyway. Right now, somewhere in a hospital, a surgeon is preparing to open someone's skull. And in a very real sense, they're only the latest name in a line of healers that stretches back further than writing, further than agriculture, further than almost anything else you'd call civilization.